Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Zoe here with us today, and Zoe's been having a lot of neck pain and muscle spasms in her neck and upper back as well. So those are the main things that she came in here for. This is only her third visit, so we're going to show you how we treat that problem. Let's take a look in the mirror here first, Zoe. I'm going to have you close your eyes and flex your head forward and backwards for me, please. Now see, when she flexes her head forward, she goes down and to the left. When she goes back into the left as well. So she doesn't have a straight forward flexion or a straight back extension. She's a little bit translated to the left of center on the x-axis. She's also a little rotated to the left on the y-axis in her cervical and thoracic spine. Pelvis is pretty much right down the middle. That's a good thing. Okay, so, and you can see she has a little bit of what's called forward head posture. That's where she's getting a lot of her neck pain and spasms. So what we're going to do is we're going to decompress her first. So have you lay on your back right there, Zoe. And let's slide you. There you go. Perfect. Right there. Slide up that way just a little bit. Now most of you who work on computers or texting all the time know that the new technology of the day has created a phenomenon known as tech neck, which is a reversal or forward head posture as a result of looking down at your computer screen or texting or handheld. Okay, she's got minimal reflexes there. Let's give my towel here today. Kind of cool in Houston here today. Sorry about that, Zoe. This towel's a little cool. Okay, so we're going to put this around her occiput and her mandible. Take a deep breath in. Let it all the way out. There we go. Good. Feel that all the way down? Good. Alright. See, so she got a little bit better reflexes after the adjustment. So you have to feel the patient's range of motion, and there we go. I still got one over here to the right I can feel. Tilt right just a little bit. There we go. Good. How did I know that? There we go. Good. So you can feel the muscle spasm, especially right down here in the levator scapulin trap. Is that where you're feeling a lot of it?
Yeah.
Yep. I'm going to show you how we work on that. In fact, on this table over here today, instead of going on your stomach first, I'm going to have you lie on your back for me. So let's come over here on this table, and I'll have you lie on your back first. So I'm going to get some blue emu oil, which is a topical analgesic that we use on patients who have muscle spasms or sore muscles. I'm just going to put a little bit on my fingers. This doesn't stain or doesn't smell. Better than BioPhysics and a lot of the other topical analgesics that are on the market like Bengay. So what I'm going to do is I'm going to start at her occiput, and I'm going to work my thumb all the way down her paraspinal muscles. Ooh, did you feel that knot? And you'll feel the knots as you go through here, and you can stop on each one of those and just hold it for a second. See, like that's a big trigger point right there. And you can actually feel them melting under your fingers. Just hold that for a couple seconds, and there she goes. Do you feel it? Starting to melt? Yep, that's a painful one right there, huh? Well, that's really moving good though. So again, you start the occiput, work right down on the top of the lamina where the paraspinal muscles are, and you feel the knot right there too. Just hold pressure on that steady, and then keep going all the way down into the trap. And then you can even do a move like this. It's called the corkscrew move. I learned this at Palmer. Taking Nemo. Not like Captain Nemo, but Nemo, a lot of people call it. Okay, so I'm just going to rub some of that over here because we got enough on there. Okay. So again, so you can get a better view on this side, we start at her occiput and work our way right down this. Ooh, this is really sore right there. So pulling your hair right down the side of the paraspinal muscles, and you can see she's got some tender spots in there, and you can see that knot right there. So I'm just going to hold some steady pressure on that. Ooh boy. There it goes, that release there. And then keep working all the way down into the trap and levator scapula muscle. There we go. Good. Okay. And then we put a little arc in her neck to help her restore her cervical curve from that tech neck, which is reverse curve. There we go. Good. Okay, now let's turn on your tummy now. So even though she's got neck and upper back primary issues, we always go down here and check the pelvis. And it's short on the left, and it gets even, so that tightens up a little bit in your lower back right there too, huh? So her left SI joint is out right here. There we go. The right SI joint here. And then I get the sacrum straight superior to inferior, or negative y-axis. There we go. And then L5 right here on the z-axis. Then L4 on the z-axis, L3. And you'll notice the my arm angle's changing as we work up the spine. Okay, I'm going to put your head forward just a little bit here, Zoe. Can you scoot up in there just a tad? Open these joints up. Okay. Yeah. Okay, I got another one. I can feel it right here. Oh, that's a tough one there. Whenever you have so much muscle spasm, a lot of times I have to get in here with my elbow. This is one of those treatments that hurts so good. It's really painful while I'm doing it, but it feels a lot better when I get done. Pretty tender on both sides, huh? Yeah. Now you want to start off slow with this. You can see I'm kind of bouncing off of that trigger point right there. And then you get deeper with it over a period of time. But you don't want to just jab your elbow in there and stick it way down in there, hurting the patient, because the pain's already in these muscles from being toxic. These are basically toxic metabolic waste dumps, trigger points, which is where metabolites build up in the muscle tissues, and blood can't carry out all the metabolic waste products of normal cellular muscle metabolism on a daily basis, so they build up in these trigger points or knots. And to get rid of those, you have to put direct, steady pressure on them and then mobilize them to move them. It's called myofascial release. That's pretty tender right there too. Which one's the most sore? The left one?
That one.
This one here?
Yeah.
It's more so than this one?
I think so.
This one feels
No,
pretty
right
tight
there,
right there, yeah. Yeah. So, now I'm going to be nice. So the tough love's over. And this is the feel good part that all the patients love. I've yet to find a patient who did not like this genie rub. This increases circulation, helps break up those myofascial trigger points as well. increasing the blood flow to help the toxins be carried out of the muscles and oxygen nutrition into the muscles. Besides that, feels good, huh, Zoe? So you guys have probably all heard the terminology tech neck. But tech neck is where you're working in an office or administrative environment all day long, like Renee, working on a computer. Now on hers, we propped her screen up with a Houston Yellow Pages, which is about all those are good for anymore, and a ream of paper so that she's looking eye level at the screen now, which is ideal. On my laptop there, you can see I have to look down a lot too, so fortunately, I don't have time to sit and do that a lot. I'm busy treating patients all day long, so I get chiropractor forward posture from just bending over patients, doing what I do all the time, but I get adjusted regularly as well, and I get the elbow treatment and the turbonator. I'm not going to use the turbonator on Zoe because I'd be punching right through her muscles and hitting her bones. There we go. Okay, see, legs should be even now, which they are. And this should feel pretty smooth now.
Yeah.
Good, okay. Let's go ahead and have you sit up and face towards Renee for a second. There we go. Ooh, boy, you got some grinding in that right shoulder joint, huh? Is that the one you use your mouse with? The right arm?
It's the one I use most, yeah. It's my right.
There we go. So those are both glenohumeral joints on the left and right shoulders. And then we get the elbow and the wrist. There we go. And the digits. So we get everything along the pathway of the entire nerve. Is it still cool outside?
Yeah.
Is it? Nice. Okay, good. Would you mind sharing with our YouTube subscribers, Zoe, about your experience here and what brought you here? And
I found you online, and I've been looking for a good chiropractor for a good while.
this will only be in your third visit. We were the first ones on the page, right?
Yeah.
So has this been a good experience for you?
Totally, I feel like that.
Great. All right. Well, thank you for sharing that with us. And let's go. We still got a shooter. You know, we love her. We're going to shoot her. Okay, let's come over here and I'm going to set this for Zoe now. Okay, let's have you put your feet even but shoulder width apart. There you go. Now flex your head forward and backwards again. Now see, it went straighter that time, both forward and backwards in flexion and extension. However, you can see she's still got a little bit of forward head posture. So her exercise is to pull her traps up, her rhomboids back, flaring the palms forward so it tightens up that entire trapezius muscle. Then we bring her head straight back in the Z-axis and lift it up to the ceiling. Look at the ceiling. Keep those shoulders up and back for me, though. There you go. Good. You'll feel a little tap right there. Keep your shoulders up and back. And I won't let you fall over. I haven't lost patience for you. There we go. Okay, now, let's do that one more time and see if this feels any smoother to you. Much better. Yeah. So, see how you're right in the center right now? Your arms are at your sides more. That's perfect. Good. Did that feel smoother to you? Good. All right. So this is your Houston chiropractor, Dr. Gregory Johnson and Zoe, coming to you from a cool Houston, Texas this morning. We'll see you next time.